KTVU's Amanda Quintana is here with what experts think is coming next and how leaders are trying to prevent it.
Well, you may remember last year around this time, we saw a huge surge. Cases went up after Thanksgiving, then again after Christmas and New Year's. That's exactly what experts expect to see again. But this time, the good news is we have the vaccine, so we aren't seeing as many people in the hospital. And while some people are getting really sick, for most, this Omicron variant seems to be milder.
With the other variants, it was a much slower uptick like Delta and Alpha, but this goes fast.
Dr. Peter Chin Hong, an infectious disease specialist at UCSF, says that surge will likely continue into the new year.
But the good news is that if you look at South Africa, it's already starting to come down very dramatically. So it goes in really quickly, but it also leaves very quickly. And that's what I'm hoping will happen.
The latest data from last week in San Francisco County shows an average of 305 new cases a day. Just 2 weeks before that, it was 81. It's a similar story across the Bay Area, and numbers are likely much higher with so many people testing at home not being reported. But there is a silver lining.
We're seeing people diagnosed with infection, but that's throughout the whole community, but not people who are ill in the ICU on a ventilator like 1 year ago.
Dr. Chin Hong says hospitals are doing okay thanks to such a high vaccination rate in the Bay Area and a culture of mask wearing. But where we're seeing a problem is testing. Long lines of cars here at SkyWest Golf Course in Hayward and at the drive-up site at Kaiser in San Jose. And empty shelves. Rapid at-home tests sold out in pharmacies like CVS and Walgreens.
Yesterday, we had to close a site at 12:30 because we ran out of tests, that site. So our pharmacies are stretched. Our county resources are being stressed.
After seeing the empty shelves himself, San Mateo County Board President David Canepa says he knew they had to make a change, going from 5,000 tests a week to 9,000 this week.
Counties throughout the Bay Area have to double down because we're seeing a six-fold increase in people who are testing positive. And the only way we're going to meet demand is to make sure that we test people.
The Biden administration is promising 500 million free at-home tests next month, but Canepa says they're needed now. But he knows testing can't be your only way of protection.
This is no time for people to be complacent. If you haven't been vaccinated, now is the time. No judgment.
While Omicron symptoms may seem like a cold or allergies, Dr. Chin Hong says the risk of getting infected with COVID should not be minimized.
I just worry that the next variant may not be quite as mild as Omicron. Again,
I asked Dr. Chin Hong about New Year's celebration, and he says there's no need to cancel all of your festivities, but be responsible. Cut down the size of the group that you're celebrating with indoors. And if you're in a risky setting, get tested 3 days later.
Amanda, I'm wondering, even if you do feel okay, if you have big plans of going out for New Year's Eve, is it a good idea to get one of those rapid tests?
It is a good idea if you can find one, which is proving to be very, very difficult. But I did talk to Dr. Chin Hong about this for Christmas. A lot of people were trying to get that rapid test before Christmas. He said if you're vaccinated, if everyone in the room is vaccinated, you should feel pretty good about it. So don't freak out if you can't get a rapid test. But also, there's not a lot of tests out there. So really, you should keep it for if and when you do have symptoms.
Good advice. Amanda Quintana, thanks so much.